Hello and welcome to the Consultation Skills course Part 5. I'm Dr. Alex and I work at the Christian Medical College in Vellore in South India. In Part 1 we saw the benefits of good consultation skills and how they are about providing better care for our patients, not just being a nicer doctor or other health professional. In Part 2 we looked at the Calgary-Cambridge Guide to the Medical Interview, looking at the 5 phases and 2 running themes in every consultation. And in Part 3 we looked at power and control in the consultation, and how we can help or hinder good communication. We saw that as health professionals we need to give some of our power to the patient so that their agenda can be fully expressed. This is the big idea and is otherwise known as patient-centeredness. Instead of the health professional being at the centre of the consultation, they help the patient to take the centre spot. So what do we need to do? We are aiming to make the consultation a meeting of experts. Now we come to the first of our 3 essential skills. In the first phase of the consultation, we are initiating the session. The health professional greets the patient and makes them comfortable and starts the consultation. This section is really important for building the relationship. Eye contact and appropriate body language to show you are attentive are essential. The health professional will then start phase 2, gathering information, by asking an appropriate opening question. I use a very broad question. I say, "Tell me your story." Here comes the first essential skill, the golden minute. The health professional should allow the patient to speak for up to 1 minute without interruption. This will allow the patient to tell their story in their own words. Please resist the temptation to dive in and ask questions. In one research study on this, the average time from the patient starting to speak to the doctor interrupting was 18 seconds. We also need to listen. Don't spend this time making a list of differential diagnoses in your head or thinking of investigations you might do. Listen closely to what the patient is saying and give them your full attention. As William Osler said, listen to the patient. They are telling you the diagnosis. Most patients will finish before 30 seconds is up. Not interrupting allows the patient's narrative to flow, and usually you will get more information quicker. When they have finished, or after 1 minute has elapsed, summarize what they have said. This will help you to clarify the story, as the patient can then correct anything you have misheard or they have not explained clearly. And it also shows that you have been listening, which helps to build your relationship. It can be helpful to bring other agenda items out now. You could say something like, "So that's the first thing. Is there any other issue you would like to discuss today?" Now it is your turn. At this stage of information gathering, the health professional needs to ask questions to clarify the issues and to get further information. The best way to do this is to start by using open questions. Tell me more about your headache or chest pain or whatever it is. What time of day is it worst, and so on. An open question will give you more information than a closed question. A closed question is one that requires a yes, no or a one-word answer. We will do some more advanced questioning techniques in a later presentation. At the end of this phase, you may want to ask questions about past medical history, family history, allergies, and do a brief review of systems. At the end of this part of information gathering, again summarize what the patient has said to make sure you have heard right and they have told you all they want to say. And listen well, as listening well and summarizing accurately builds a relationship of trust with the patient and helps to structure the consultation. Now, some of you may object this will take too long and you have 80 patients or more to see in a day. In reality, interrupting the patient may take longer as the patient's narrative flow is disrupted. If you let the patient talk, you will get the information you need. Sometimes interrupting may seem quicker, but you will not get the whole story, and so you may make the wrong diagnosis. So that is our first essential skill, the golden minute. And now for 2 simple exercises. First of all, ask a friend or relative to tell you what happened in their life today. Don't interrupt for 1 minute. Just let them speak without asking any questions. How did it feel? Most people find it very difficult not to interrupt. Finally, look at the video of the first phase of the consultation between Dr. Duncan and Mrs. Jackson. How much information does Dr. Duncan get in the gathering information phase? The video is on Moodle, or if you're using YouTube, it is Consultation Video 1 in the channel. A transcript is available via the link if you are having difficulty working out what is being said.